Hello and welcome to today's in-service on Ehlers Danlos syndrome, an invisible but debilitating genetic condition. So what is Ehlers Danlos? Most of you have probably never heard of it before, but it's an inheritable genetic condition. It affects the connective tissues, which are the tissues that support skin, bones, blood vessels, and other organs, and it makes up the majority of the mass in your body. Because of the level of involvement of connective tissue in the body, there are a range of symptoms that can occur, ranging from mild symptoms that are classically associated with Ehlers Danlos to more life-threatening complications. Ehlers Danlos was thought to have existed for thousands of years, with the first case being noted way back in 400 BC, in which there was a case of a boy who had stretchy, extensible skin. But the first joint association with the condition was in 1892, so that was a long period of time with no advancement. And then Ehlers Danlos finally got defined in 1901 by Edward Ehlers as a distinct disorder in a case history that includes lax joints, hyperextensible skin, and a tendency to bruise easily. Sometimes children with Ehlers Danlos have bruises that look like they could result from child abuse, but it's actually just a part of their connective tissue genetic dysfunction. In the 1900s, as medicine was advancing, so were advancements made in studying Ehlers Danlos and learning about Ehlers Danlos in the medical field. And so a second and third case study were studied over the next few decades, and the syndrome was then named after two of the early medical discoverers, who would be Edward Ehlers and Henry Alexander Danlos. At the time that Ehlers Danlos finally got its name, there were very few characteristics associated with the condition, but different classifications were noted in the 1960s and then formalized in 1988 by Baton, who actually created a scale to help in the diagnosis of Ehlers Danlos. They classified 7 types, some with lettered subtypes, and they redefined them in 1997 to include only 6 types. As of today, the prevalence is thought to be 1 in 5,000 approximately across all of the subtypes of Ehlers Danlos syndrome. Since the naming of Ehlers Danlos approximately 100 years ago, the understanding has changed. We used to think that there was only involvement of skin, joints, and easy bruising, but the characteristics have been expanded. We now know that the model of symptomology is very complex in Ehlers Danlos. Just some of the symptoms include gastrointestinal complications such as food not digesting, ulcers, autonomic nervous system dysfunction, including the inability to have appropriate sleep, for the body to regulate itself upon standing, blood circulation. There's some other neurological associations such as sleep paralysis that are rare. There's just a heavy involvement in all bodily functions and systems. Because of the loose joints and skin, there are sensory processing challenges for students who have this condition, gravity-induced fatigue, complications with cognition and focus. Processing speed is usually slowed down because of the inability to filter out information coming in due to the proprioceptive dysfunction. There's a lot of anxiety involved because their bodies overproduce adrenaline. They often have an inability to self-regulate both emotionally and physically. There's a lot of pain involved due to joint dislocations, micro injuries, and the pain tends to just be accepted as normal by the patients. This is a condition that you are born with, so they often don't know what it is like to live a life without pain. These are just some of the symptoms, and there are many additional symptoms involved Children's Hospital of Cincinnati has a great model to look at if you'd like to know more. So we know that Ehlers Danlos exists from birth, but how do we identify it? It's often known as an invisible disease, so you often can't see the features outwardly on a person. So there are a few different ways that the condition is diagnosed. It is a genetic condition, so it does involve a genetic mutation. Some of those mutations can be tested for genetically, but others there is not a specific mutation in a gene that they can find through genetic testing, and it depends on clinical observation. So there's something called a Baton scale where they'll test the flexibility and skin conditions associated with a condition to see how many points you get and see if you meet the threshold for that. If you have an extensive family background involving Ehlers Danlos, or if one of your parents has Ehlers Danlos, you have a 50% chance by birth. So any symptomology representing the condition would be considered evidence of having the condition yourself. So here is a visual model to just help you understand a little bit of how complicated this condition is. Just take a minute and look over this. So you're probably wondering about the zebras. The zebra was adopted kind of as the mascot for Ehlers Danlos because in the medical community, rare diseases are represented as zebras, and more common conditions are considered to be horses. And doctors that work in these rare genetic fields are taught, as well as general practitioners, that when they hear patients come in with symptoms, they should be assuming it's a horse and not a zebra. But Ehlers Danlos patients are here to remind you that zebras do exist and our condition needs to be taken seriously. Unfortunately, all of that red tape causes a delay in getting an accurate diagnosis. Often there are misdiagnoses along the way for people who actually have Ehlers Danlos, and it can take 10 years or more to get a formal diagnosis for the condition once you start seeking treatment for the symptoms. Ehlers Danlos is not directly associated with any significant impact to cognitive ability or IQ, but it's often misassociated with specific learning disabilities, ADHD, and other categories of disability when, in fact, it should be classified under OHI because none of the other classifications are sufficient to explain all of the symptomology associated with Ehlers Danlos that can affect a student educationally. Some children with Ehlers can manage to suffer in silence and get by without drawing attention, but they really do need supports to receive a free and appropriate education. Some of the best practices that have worked for students with Ehlers Danlos who have a 504 or an IEP, or providing physical therapy or supports for preventing injuries at school. Muscle tone, balance, coordination, and sensory dysfunction are associated with Ehlers Danlos. Some of the accommodations that have been helpful are extra time due to processing speed or motoric challenges in writing, extra breaks, and also slant boards for writing to prevent fatigue. So an occupational therapist would be a recommended support service for both the emotional regulation and also for working on writing. Visual supports can be helpful in case there's a challenge in processing the auditory information as quickly as it's presented, but the visual supports should be meaningful and not overstimulating due to the inability and challenges with filtering out information with children with Ehlers Danlos. A few other strategies that have been successful would be preferential seating, headphones, and privacy boards to help prevent overstimulation. Not many doctors know about Ehlers Danlos, let alone schools, and so families of children with Ehlers Danlos do feel misunderstood and invisible, just as the condition of their children. It is a rare condition. Acquiring help can be difficult. The children don't fit into one box on the forms that the psychologists and other professionals have been trained on, and so it's difficult to explain to these team members that they need to think outside of the box. The symptoms in each case can be very individual, so it's hard to even try to create a box for Ehlers Danlos. The child needs to be looked at individually. That needs to be the biggest point that professionals should know when considering parental and family concerns. Ehlers Danlos is a group of medical disorders, so there is some overlap, but based on whatever family's genetic mutation occurred, the symptoms could be quite different. And really all the parents want is what's best for their children. They want their children to learn. They want their children to be successful, just like any other parent would. Thank you for coming today, and I hope you leave here with a little more knowledge about Ehlers Danlos and how to provide an appropriate education for students who have this condition. If you'd like to learn more, I've provided a few resources that have extensive information on the web from medical perspectives as well as from family perspective and school perspectives. So please take a look at that if you're interested, and thanks again for coming.